So I'm a movement disorder specialist, and I treat patients with Parkinson and other movement disorders. So you are in the right place, because before we start talking about the therapy, we need to put a diagnosis, okay? Originally, I'm from Romania, where I did my medical school in addition to a residency program in radiology. I did my training in neurology at the University of Oklahoma, and followed by a 2 years fellowship in movement disorder at Cleveland Clinic, Ohio. I came to Austin to start and develop a movement disorder clinic. The purpose of this clinic is to provide a continuum and complex care to patients with various forms of movement disorders. We treat Parkinson patients or patients with Parkinson plus syndrome, different forms of tremor and dystonia, Huntington disease, gait problems, and other forms of movement disorders. I do work in a very strong collaboration with neurosurgeons, neuropsychologists, psychiatrists, and other specialists in town. The role of a movement disorder specialist is to be there to provide that continuum and comprehensive care. At our clinic, we have a support group that meets once every 2 months, and I encourage patients to stay very active physically, professionally. The optimal therapy of patients with Parkinson's disease implies medications, rehab, and sooner than later today, we have to consider the surgical procedure, deep brain stimulator surgery. Deep brain stimulator for Parkinson's disease is recommended today to be done earlier than later. The reason is, if the surgery is done before patient suffers from deconditioning, from the dose failures, in long term will have a much better quality of life. Sometimes the motor symptoms are not the most disabling symptoms, and depression, anxiety can be more disabling. One of the hardest part of my job is to try to convince a patient that with optimal therapy, he or she can have a life. It's true we don't cure the disease, but with the treatments that we have today, patients can have a quality of life. After 3-4 months of therapy, they learn that they can be better than they were 4 years ago. And the family and the friends are happy because they said, you give him or her back. You as a doctor, when you hear that from the patient and the family, is the most satisfying thing that you can have as a physician.